UNC-12 Probe. The parts of this instrument are the handle, we have the shank, and we have the working end. There are markings at each millimeter, 12 of them, and it has color bands between 4 and 5, and also between 9 and 10. So between 4 and 5 there's a band, and between 9 and 10 there's another band. And the way we read each black line is, for example, we insert the probe in the gingiva, and if it's not covering the first line, then it will be 1, and if it's right there, it will be 1, and if it's past the first line, and even though it's not all the way to the second line, then it will be a 2. Right there, it will be at 3, even though it's not all the way up to the third line. So when I insert my probe, even if it's not covering the first line, we would not mark that as a 0. We would write down 1. And if we probe this side, that would be a, I don't know if you can see it, okay, there. We probe there, then it's going to be a 6, because it's past the colored band right there. Probing is important for the diagnosis and management of periodontal disease. So with the periodontal probe, we can chart probing depths. We can also record signs of inflammation. Like when we probe, there are some areas that are going to bleed. And we can also measure recession. We can measure if we notice a lesion in the gingiva, or buccal mucosa, or on the tongue. We can use the probe to measure the length and width of the lesion. We can also measure mobility and clinical attachment. The contraindications for the use of periodontal probe: we shouldn't use it if there's an acute infection to the tooth or the gingiva, like acute necrotizing ulcerative gingivitis, or if there is a trauma to the tooth, like a cracked tooth or severe inflammation in the gums, then we shouldn't probe, because it's going to cause a lot of pain and discomfort to the patient. There are also patients that have a systemic disease that is uncontrolled, and we should be careful while probing, because when we probe, we can cause bleeding, and that can cause bacteremia. This is tooth number 32. We're going to start measuring from the distal line angle towards distal, and we're going to record the deepest probing depth in that area. And then we're going to start from the distal line angle toward the mesial line angle. We record the deepest probing depth, and from the mesial line angle toward mesial, we record the deepest probing depth. And then in the lingual side, we're going to do the same, but this time we're going to start from the mesial line angle toward mesial, and we record the deepest probing depth. And from mesial line angle toward distal line angle, we record the deepest probing depth, and from the distal line angle towards distal, we record the deepest probing depth. We have to use a light grasp and pressure on the instrument, and use a fulcrum. And if we have a tight grasp on the instrument and we apply too much pressure, we can hurt the patient. If we use a light grasp, it's better to feel the anatomy of the tooth, for example, the CJ. When we are walking the probe towards the interproximal area, we have to angle the instrument 10 to 15 degrees to measure the distance into the cold space. We are going to walk the probe until we reach the interproximal surface and the contact area of the adjacent tooth. When we are there, we have to angle the instrument 10 to 15 degrees into the cold space. My instrument here is tilted 10 to 15 degrees into the cold space. You have to keep the instrument parallel to the tooth, but in an angle. You have to follow the anatomy of the tooth, and you know that the roots of the teeth are going like they're like tapered. So you have to angle the instrument towards the surface of the tooth. If you leave it straight like that, you're going to poke the gum and hurt the patient. The correct order for probing: we start from tooth number 1, and we do all the buccal surfaces, 3 measurements each tooth, and until we get to tooth number 16. Then we move to the lingual surface, and we start from the mesial distal line angle toward mesial, and line angle toward line angle, and line angle toward mesial. And we go all the way back to tooth number 1, and we did all the lingual surfaces. Then we move to the mandibular teeth, and we start from the buccal surface of tooth number 32. We start from the distal line angle toward distal, and line angle toward line angle, and then line angle toward mesial, and we move all the way to tooth number 17. When we get there, we're going to move to the lingual surface of tooth number 17, and we're going to start from the distal line angle toward distal, line angle to line angle, line angle to mesial, and we move all the way back to tooth number 32, and we finish with all the surfaces.